Today, we're talking about a tale of two healthcare systems. This is the hidden reality of healthcare transformation. You've probably seen headlines about healthcare going digital. The future is home based care, hospitals without walls. But what we're not talking about healthcare in 2025 is that we're witnessing the emergence of two parallel healthcare systems, and the gap between them is widening every day. Hi, I'm Christina. I'm an emergency room social worker, and I talk about social impact through the lens of healthcare finance and strategy. From my vantage point, I've been watching a trend unfold over the last few years where some patients are benefiting from the unprecedented advances in home-based care and digital health, and others are falling into an increasingly complex web of social and medical challenges. And today I want to talk about this divide and what it means for healthcare leaders. In the first system, we have the digital revolution, and we'll start with this good news. We're seeing incredible advances in value-based care arrangements enabling comprehensive home care, digital health platforms revolutionizing monitoring, ambulatory surgery centers making procedures more accessible, and remote patient monitoring keeping people safe at home. Telehealth is breaking down access barriers, and the global digital health care market is projected to reach $210 billion this year, up from $76 billion in 2018. This is the healthcare system that we see in commercials and in pitch decks. It's exciting and it's real. These advances are transforming care delivery for many patients. Then we have the second system, and this is the social reality. And it's happening in parallel, and here's where it gets complex. So while we have 90% of adults aged 65 and over preferring to age at home, the reality isn't so simple. We have, in early 2024, CMS authorized over 320 hospitals across 37 states to offer acute hospital care at home. Home health care reduces readmissions by 25%. Now, in this same system, hospital beds are then filled with patients who are too sick for home care, and beds are occupied by people who lack basic resources for safe discharge. These are complex cases that require intensive family support and coordination. These are vulnerable patients that struggle to navigate fragmented services. So let's talk about what lack of resources really means here for our patients. This is no stable housing for recovery. This is no reliable caregiver support. And this is a big one. The same staffing shortages that healthcare experiences are experienced in the caregiver sector. As a social worker, helping families find private duty caregiver support so that families could hire care instead of taking their loved one to a facility or taking FMLA, it was next to impossible in 90% of these cases because it was either too expensive or it was very difficult to find the appropriate amount of coverage required. There was limited transportation access. And this is again the case of systems that are built with the needs of the average person in mind and not the average patient. When we consider the average patient, i.e., the patient who statistically is the largest user of healthcare services, they struggle with getting adequate transport. They often rely on public transit systems that are designed for workers and not medical appointments. Family members taking unpaid leave to provide rides, underfunded medical transport services with 2 to 3 hour pickup windows, rideshare services that they often can't afford, and emergency services as a last resort, driving up total cost of care. Other lack of resources can include food insecurity affecting recovery, medication management challenges, limited health literacy, and complex social needs. So in this growing divide, what healthcare leaders need to understand is that this divide isn't temporary, it's structural. The population needing intensive support is larger than most realize. Digital solutions alone can't bridge this gap. Social care infrastructure is becoming more critical, not less. So ironically, as we advance technologically, we're becoming more dependent on basic human connection and support than ever before. Now, let's talk about the business imperative. Why should healthcare leaders care? Value-based care success depends on addressing both systems. Digital health ROI models aren't accounting for these inaccessible population, and this creates a significant blind spot in strategic planning. Simply waiting for technology to trickle down isn't viable here. Readmission penalties are hit the hardest with vulnerable populations. Length of stay metrics suffer without social support. Patient satisfaction scores reflect social care quality. Population health outcomes depend on social infrastructure. And so there's these hidden cost drivers. Every day a patient stays due to social factors is revenue loss. We're solving clinical pathways while social factors drive these readmissions. And the total cost of care management becomes impossible without addressing social needs. Now, I'm not arguing against digital innovation. Every patient I've met would rather recover at home when it's viable. But we need to be very clear about this reality. The real revolution isn't just digital, it's social. And healthcare leaders should invest in social care infrastructure. They should build robust advocacy programs and strengthen community partnerships, build up these communities, developing comprehensive support systems, and bridge these digital social divides. The future of healthcare isn't just about technology, it's about human connection. And as we build this future, we need to ensure that we're creating systems that work for everyone, not just the digitally enabled few. I'm Christina. This is Outcomes. Join me next time.